Hi, my name is Gabrielle Williams, and I will be talking about Neonatal Abstinence Syndrome today, also known as NAS. NAS is withdrawal syndrome of infants after birth caused by in utero exposure to drug dependence. The primary drug abused is opioids. An example of this would be heroin. Other drugs that can cause NAS include drugs used for pain management, such as codeine, morphine, hydrocodone, and tramadol. Antidepressants, obviously used to treat depression, and benzodiazepines that help treat sleep disorders can also cause NAS. A little bit of pathophys as to how exactly the drugs get into the baby's system is that the drugs will be ingested or injected by the mother and go through the placenta. The placenta grows in your uterus and supplies the baby with nutrients and oxygen, and that's how the drugs are delivered to the baby's system. While associated with drug abuse, NAS can even be caused by mothers following PCP's instructions with their opioid prescriptions. Because of this is an important education for the nurses to tell the mothers not to immediately discontinue drug or opioid use, for it can be harmful for both the mother and the baby. Some signs and symptoms of NAS include trembling, irritability. This is seen through excessive, high-pitched crying, seizures, and sleep problems. Most signs and symptoms occur within 3 days of birth. They can last from 1 week to 6 months. It is very rare, but it can happen, that signs and symptoms will occur immediately after birth or a few weeks later. The severity of the signs and symptoms depend on what drug the mother had used, how much of the drug was used, how does the mother's body break down the drug, and if the baby was born prematurely. If a baby is born prematurely, it actually reduces their risk of NAS. Some complications caused by NAS is a decreased birth weight. This is, actually it's not decreased, it's a low birth weight, meaning it is lower than 5 pounds and 8 ounces. Jaundice, which indicates the liver isn't fully developed or functional, and needing intensive care, usually in a NICU setting. NAS can be tested through scoring done by the primary care provider. There's also a test called the Meconian test, which is assessing the baby's first bowel movement, and a urine test as well to detect which drugs are in that child's system. Treatment usually requires pharmacological intervention with methadone or morphine. Once the signs and symptoms have reduced, the baby is then weaned off those drugs using a strict protocol that can extend for over 3 weeks. Drug intervention is required for 50 to 70% of infants with NAS. NAS also increases the risk of sudden infant death syndrome, SIDS, also known as crib death, and this is when a baby will die in their sleep. I found an article that I thought was interesting. It is called The Impact of Psychiatric Medication Co-Exposure on Neonatal Abstinence Syndrome Severity. Basically, it was a study done to see if there was an improvement with mothers who took psych meds for opioid abuse versus those who didn't, and whether or not they had better NAS outcomes. Psychiatric polypharmacy is common and associated with severe neonatal abstinence syndrome. The result of the study was that mothers who took concurrent psychiatric medications were indeed associated with worse NAS severity, meaning when medically indicated, limiting the use of multiple psychiatric medications, particularly benzodiazepines, during pregnancy should improve NAS outcomes. If you guys have any questions or concerns, feel free to comment below, and I will try to supply you with as much information as possible. I will be posting this link, obviously, on the discussion board, as well as my email if you would like a hard copy of this information. Have a great day. Bye.